Surgeons of Reddit, what was the biggest mistake you made while operating on a patient? Story 1, not a surgeon, but I am a histotech. We work in the pathology lab where all the specimens are sent. A surgeon did a double mastectomy based off a different hospital system's pathology report. Basically, the report said she had the kind of breast cancer where both breasts need to be removed, but we found zero cancer in either breast. He was shitting bricks, so we submitted both breasts in their entirety. That's a ton of blocks, and it's unheard of to submit all the tissue like this, but he needed to find cancer. I've never seen a surgeon stand there and watch the pathologist like this guy did. We all felt so bad for him and OFC the patient. He was so upset, cussing up a storm the whole time and screaming about this is why I never take outside pathology reports. Turns out the other lab had mislabeled her specimen, so some other lady got the all clear who had cancer, and she lost both breasts when she didn't. All around horrible situation, and the surgeon was sick over it all. Story 2, malpractice stories can be tough. They'll lighten the mood a bit. Was doing varicose vein surgery on a very posh middle-aged lady. Very cut-class accent. There's an anesthetic that we use that sometimes induced some hallucinations, either going under or coming out of anesthesia, and heard some funny things. Anyway, this lady was in recovery, just coming out of the anesthetic. The team were around waiting for her to wake up and gag a little on the tube in her throat for breathing. So we knew it was time to remove it. She gagged, we removed the tube. She smacked her lips and said loudly, in her incredible accent, "That's the best bit I have had in years." The whole recovery room just fell about laughing. Luckily, she didn't remember it. Story 3, med student here. I was watching a knee operation when the surgeon suddenly stopped, looked towards the staff absolutely shocked, and asked, "This is the wrong knee, isn't it?" Basically, he was told to operate the wrong knee and halfway trough. He realized it was too good looking to be the knee that needed the operation. Luckily, there was no permanent damage done. The team reknit everything together and rescheduled the surgery. Story 4, not the surgeon, and I'm sure not even sort of his biggest mistake, but this was one of the more bizarre things I've witnessed in an surgeon brought a bad pair of glasses. So here we are, total hip replacement. Surgeon is going to town with what I lovingly call the human grater, which is a doohickey to make sure the new hip socket will fit in. Picture a cheese grater wrapped around a golf ball on the end of a power drill. It's not pleasant anyway. Dude's grinding away at the feller's hip and sudden yelps in surprise and stops, backing quickly away from the table. We're all like his glasses spontaneously broke in half. They were the type that didn't have rims, just lenses with a bar across the nose and bars for the ears, so the metal crossing the nose snapped at the screw. Surgeon quickly starts stripping off his gown, etc. Had the full face shield get up, ortho ORs are splashy, and leaves the room. Comes back with a roll of tape. Him and the circulating nurse can't get them fixed, so he just holds them to his face and has her run the tape around his head a few times. Then suits up again and goes back to acting like nothing happened. All in all, added like 10 minutes to surgery time, at least that I could catch directly. Hadn't been with that surgeon before, but I can't imagine that was his best performance afterwards, seeing as how his glasses were taped across his eyes at weird angles. But yeah, don't buy 5 readers for the OR. Story 5, not a surgeon, but I had a screw put in to hold together a fracture in my wrist. At the last moment before surgery, the anesthetist told me I could have the surgery with a local rather than general anesthetic as planned. So I let her make the call for me to be awake. During the drilling, my surgeon started complaining at length of why he hates the drill he's using and how it's inferior to the other type or brand. It was apparently the only one he could find at the time, and he didn't want to reschedule. Once the screw is in, the surgeon says to close up. Someone asked if the screw should protrude as much as it was, to which he responded no, but we can get away with it. And you never want to take a screw out and put another in, as you essentially were the thread of the bone. Then silence for about 10 seconds while I feel them shifting wrist around, followed by, "Actually, we better put a smaller screw in." When I was in recovery, the surgeon was surprised how quickly I woke up and had a slight look of surprise when I told him I was only under local. Next thing he said was surgery went well. Story 6, not a surgeon, but work for pathology. An oncologist I met at the lab would tell me all of these horror stories. We'll never forget about the one time a nurse threw someone's donated organ transplant into the rubbish bin, or when a man had the wrong leg cut off. Story 7, veterinarian here. We do quite a few surgeries, so I hope this counts a real response. Mistakes likely happen all the time, from nicked blood vessels to skin organ tears. Most are probably fairly minor. In the veterinary world, I've certainly heard stories of male animals having an abdominal incision during a neuter since someone thought it was a female for a spay. Wrong limbs can be amputated, surgical instruments and sponges gauze can be forgotten in patients. There are many pre- and intra-surgical checklists to help prevent these, and I am sure it is even more developed in human medicine. Fortunately for me, the biggest surgical mistake is probably a suture slipping when removing an organ resulting in minor internal bleeding. Fairly easy to find a bleeder and get things stopped rather quickly. Or having a small bone break when repairing another fracture. Things happen. We address it and learn from it for all future patients. Story 8, I'll share my not a surgeon, but encountered a weird hospital mistake. Worked for a funeral home, picked up remains from the hospital morgue, and discovered an extra foot prior to cremation. Was an interesting call to the head of that department. Story 9, my mother's surgeon well, not doing basic math correctly, and sewing up a woman having spine surgery with 2 sponges still inside of her. My mom was 20 years sober, so she refused most of the pain meds. When I had to confess they up, she had a mental breakdown facing all that pain again. She got a lawyer, and they settled ASAP, about $50K. Mom thought that was fair, but my godfather is a retired federal prosecutor and said it would have been $100K easy with another attorney. Update, want to thank everyone on behalf of my mom for the good thoughts. This happened about 15 years ago. My mother has a master's in biology and knows, well, happens. It's a testament to her character that she decided the settlement was fair for an accident. Yet another example of how extraordinary my mom is and how underappreciated this retired HS biology teacher remains. Story 10, not a surgeon, but I can tell you of one. My mother-in-law had a bad fall while on vacation in Florida and had to have hip surgery. During they nick her bowels without realizing it until almost 2 days later when she started complaining of abdomen pain and her blood pressure started dropping. By then, she was already septic, went into a coma, and they couldn't save her. The hospital declared her death natural causes. We only know otherwise because my husband's family hired someone to do an autopsy before they cremated her body. Story 11, I'm not a surgeon, but a nurse. We were doing an APR for a patient with rectal cancer. Quick summary. You remove the rectum anus, close the anus, and the patient has a colostomy for the rest of their life. This procedure was done robotically. The rectum was removed attached and wasn't immediately removed, not uncommon. I went to lunch, and when I came back, noticed the lack of specimens on my table. The patient was already closed and minutes away from being extubated. The surgeon had to return to the OR, reopen the patient, and remove the specimen. Big deal, but luckily no real harm to the patient. Story 12, I've already wrote one about the knee surgery, but hey, race another. This one is not a personal experience, but a case that I read and stuck with me. So a surgeon amputated the healthy leg of a 52-year-old instead of the other leg. He was already cutting the wrong leg when a nurse looked through the patient's file and stopped informing him that he had been working on the wrong leg. Apparently, the surgeon denied responsibility for the error and shifted it to other staff members involved in the surgery, since the blackboard in the operating room, the operating room schedule, and the hospital computer all listed the wrong leg for amputation. Also, the wrong leg had also been prepared for surgery prior to the doctor's arrival. The surgeon added that he didn't realize that he was cutting the wrong leg because it was also and might have needed to be removed in the future. Story 13, I'm a patient, but I'll tell you my story. Went in for an emergency appendectomy, woke up and could never go to. Turns out the surgeon injured a nerve which caused my bowel to be paralyzed. I was on 5 laxatives a day for several years with no relief. My GI doctor told me I'd be lucky if I could one day go to the bathroom once a week. Story 14, a long time ago, I worked for a law office as an administrative assistant. The office represented doctors who were going in front of a medical board to defend their licenses when they were accused of violating medical conduct. There were surgeons who routinely left items in their patients over and over again, who kept getting let off. A doc who was forging paperwork for parents to show that they provided services to their kids when they were never provided, which caused an outbreak of disease and resulted in innocent people dying. There were doctors who were using their medical knowledge to poison family members. I obviously can't go into any detail, but that was terrifying. Most of them kept their licenses and faced no recourse besides losing a little money in a malpractice suit and getting their malpractice insurance raised and occasionally paying a fine to keep their license. There are a lot of good doctors out there. These are not them scary outcomes. Story 15, you're not going to get a lot of answers on this for a number of reasons, but I can tell you what you're not being told. Wrong site surgery, ill-positioned patient that causes complications, excessive bleeding due to surgical complications, i.e., I cut the big red, big blue. Wrong products being used on the patient due to similar names or unfamiliarity. Putting implants where they do not belong. Contaminating the sterile field, causing increased risk for infection. Poor surgical planning, patient really is not a surgical candidate or the operation will most likely have only marginal clinical benefits, etc., etc. Story 16, 13 years in practice as a surgeon. Thus far, so myself haven't had any major operative EFF ups. However, Everyone who is a surgeon gets their training at some kind of academic medical center. The mentors at these places tend to be of two varieties. Type 1, the highly competent role models, and Type 2 surgeons just barely competent enough to stay in practice, but with their mistakes frequently reviewed publicly for educational purposes by the trainees who also work at the same facility, so they can call those of Type 1 for rescue help during the operation. By far the most common mistake made by Type 2 surgeons is doing operations in patients that were beyond hope of recovery. This frequently results in suffering for everyone involved and many times a more expeditious death for the patient with a terminal illness. A good example would be attempting to resect large, unresectable metastatic cancers wrapped around sensitive vital structures. Some Type 2 surgeons make careless mistakes like how I watched a vascular surgeon that forgot to reverse the vein graft when doing a bypass so that all the valves are pointed the wrong way and the graft doesn't flow. I also once saw a cancer surgeon use the ultrasonic dissector to accidentally divide the external iliac artery. I've heard about inadvertent vascular injuries to the iliac vein and aorta. All but the last of those were identified and corrected with the patient suffering no adverse consequence. Lots of times bowel injuries are missed, and the patient has to go back to surgery for a resection or repair. That's super common because the bowel is pretty thin and fragile, and partial thickness tears can break down in unhealthy patients with a lot of previous surgery and lots of adhesions. Even great surgeons get leaks once in a while for all kinds of reasons, but most commonly overconfidence in a really sick patient's ability to heal a technically proficient surgery. Sometimes timing an operation or part thereof is the most critical thing. Having good enough blood pressure, heart rate, oxygenation, and nutrition are just, if not more important for some types of surgery, where functional organs are reconstructed rather than just being removed. There are some common sayings among surgeons, and one of these is it takes 5 years to learn how to operate, 10 years to learn when to operate, and a lifetime to learn when not to operate. Story 17 in Japan. Heart surgeon number 1, steady hand. One day, Yakuza boss need new heart. I do operation, but mistake. Yakuza boss die. Yakuza very mad. I hide in fishing boat. Come to America. No English, no food, no money. Daryl give me job. Now I have house, American car, and new woman. Daryl save life. My big secret, I kill Yakuza boss on purpose. I good surgeon the best. Story 18 surgery resident here for the non-medical people. A doctor who's in middle of a 5 to 8 year surgery training after med school. This is not my mistake. I was not scrubbed in this case, but a mistake of a mentor of mine who I consider one of the best surgeons in terms of surgical technique, warm bedside manner, and, as a teacher, a healthy young patient with acute appendicitis, booked for laparoscopic appendectomy. This is a minimal invasive operation commonly performed every day for removing the appendix through 3 small 1 to 2 centimeters incisions, followed by placing special ports through incisions to allow laparoscopic instruments to go in your belly. Before placing the ports, we inflate your belly with CO2 like a balloon to make space for the trocar ports. Each of these trocar special ports image a trocar, have a pointy javelin-looking thing, so it can enter the abdomen. The first one goes around your belly button, the second goes somewhere below the belly button, a few centimeters. The third one goes somewhere on your left side of the belly. In my mentor's case, the first port went in smooth, but upon placement of the second port, the trocar, a javelin-looking thing part of the special port, went through and through the crotch of common iliac artery, and also into the left iliac vein underneath it. Vascular surgery was called in emergently. The abdomen was opened up the old-fashioned way via laparotomy, vertical incision middle of belly, and vascular team tried to repair the injury. The patient coded from massive blood loss and eventually died after many hours of CPR, resuscitation, and transfusion. The loss affected everyone in the surgery department. Not just my mentor, it was devastating. Edit, thanks for the silver. Wow, first time getting it. Story 19, not the surgeon, but I am a nurse in a hospital. Without going into too much detail, I had a patient who bled into her abdomen for 10 minutes during surgery, without anyone noticing. The surgeon was focused on fixing a smaller bleed in another location. Story 20, not a surgeon, but I remember my friend telling me of her father's stomach surgery or something. They left a sponge inside his stomach. I forgot when they realized they did, but I do know her father is better now. Story 21, not a surgeon, but a few years ago, my mom had a major stroke, which left her on a permanent feeding tube placed in her abdomen for about 3 months of her recovery. I will say she got the absolute best care other than this incident, and she had a miraculous recovery. To quote the doctors, when she had the feeding tube removed from her abdomen, we weren't worried because it's a fairly simple procedure for what we were told. Then my dad goes to change the bandage when the time comes. And what else does he find but a string sticking out of my mother's incision? So he called the doctors. thinking that probably wasn't right, and they very quickly got her back in to remove the pieces they left in her. My dad taped the string to a sticky note and hung it in the kitchen. He said he'd file a lawsuit, but nothing yet. I think he was just glad she's alive and tired from all we'd been through. Story 22, I am actually quite poor IRL. A nice internet friend of mine was kind enough to share some awards with me, which was extremely nice of them. Will not disclose the name so they don't get spammed, but I hope this clears things up. 2020 was a tough year, and although I usually am unable to give, for once I can. All replies to this comment get a gold. Stay safe, Redditors. Story 23, not a surgeon, but my mom told me the story of how I had a surgery after I accidentally cut my eye open with a stick and my doctor was trying to fix my pupil. Apparently my pupil was in the shape of football, and he tried to make normal, but instead he up, and it made my vision worse. Now, because of that, my vision is 20,100 in my left eye, and it can't be fixed. Story 24, I replied to one of OP's comments further down, but reposting in the general thread since it's a serious response. I haven't worked in a surgical setting, but I did work as a firefighter EMT for 8 years. The worst error, mistake, and judgment I witnessed was a paramedic delayed the transport of a critical PT by 40 minutes because they could not get an ET tube intubation on a patient. The patient's airway was compromised due to head first fall off the rafter of a garage he was building. We had a secondary option for airway protection called an IGL. It is very easy to insert and should have been resorted to due to the PT's condition. Unfortunately, the paramedic chose to attempt the ET tube intubation 6 times. Our county protocols only allow 2 attempts before finally letting a life flight paramedic who had arrived on scene make an attempt. This paramedic was also unsuccessful and resorted to the IGL immediately. No idea if the patient made it or not, unfortunately, but the paramedic got in a bit of trouble over this call. Story 25, not surgery, but perhaps it's less shocking because we have a more chaotic environment, but I've lots of stories. Many years ago, trying to straighten out some fractured forearm bones, I managed to dislocate the wrist. The patient was very likely headed to surgery anyway, but I tried so hard that I made it worse. I've given activated charcoal to an overdose patient that then progressed to needing intubation, much more difficult to do when everything in the back of the throat is pitch black. Sometimes one injects too much local anesthetic, and it distorts the tissues, making it more difficult to close a laceration in the best cosmetic way. It's a fine line listening to the patients that always want more painkiller, but also want a pretty result. I once saw a kid with a runny nose the night before his parents had tickets to fly to Disney. Silly me. I examined his ears. Although no ear symptoms, he had a bright blue piece of plastic in his ear. Therefore, I felt obligated to get it out. Kid is not cooperative. Sedation. Lack of success. Multiple docs tried. In this situation, we usually discharge to go to ENT clinic tomorrow, but they had morning plane tickets. I don't recall if they rescheduled their plane tickets or went to Disney with asymptomatic ear plastic, but after hours and hours fruitlessly messing around with me, I feel I probably ruined their Disney trip either way. Story 26, med student. So, I was just there to observe elderly lady with dementia in for an above-knee amputation. After cutting through her tissue to expose her femur, the surgeon started with a bone saw and within a few seconds started cursing, and everyone around him seemed perplexed. Turns out the patient had a rod in her femur that the surgeon did not know about. A few other surgeons came rushing in a few minutes later, and they all figured it out eventually with a mallet and lots of pounding. I had a lot of questions, but was not in the right place to ask with all the tension in there. I guess it was a learning experience. Story 27, not a surgeon doctor, was the patient when I was between 7 and 9. I had my first port put in. It's a 4 catheter attached to the main vessels in the heart. When I woke up, I knew something was wrong. I have CF, so my lungs were horrible already, but this was way worse. I couldn't breathe, and I was in so much pain. The doc thought I was just being a kid and not handling the pain very well. My nurse knew me pretty good, and after me crying and struggling to breathe for a few hours, she convinced the doctor I didn't normally act like that and something was wrong. He ordered an x-ray, and we found out the surgeon had accidentally sliced my lung when putting the port in, and my lung had collapsed. Ended up having a tube put in my chest. Story 28, when I was in school, I had an instructor who took a job as VP of patient care at a big American hospital. She said there was a patient who had been on the unit for a year, and the hospital was footing the bill. When they told her why, it was just about the worst thing I've heard. He was in for a brain surgery, and they had removed the large section of his skull to access the brain. Then they dropped it on the floor. They tried to clean it up, and they apparently gave him lots of post-op antibiotics, but he inevitably developed encephalitis or meningitis, or well, probably infection of the whole head, not necessarily the surgeon who dropped it. Story 29, not a doctor, but a patient. I had a shoulder replacement, and one of the doctors nicked an artery. They were panicking to try and find the nick, doing everything, and whenever they saw it filled with blood, at some point he got sight of it and jabbed at it with the clamps, and finally got it. Problem was there's a cluster of nerves directly behind the artery. So after they fixed up the nick, they had to go through the process of checking if they damaged the nerves, and if my finger still worked. The doctor tells me he'll be telling that story to his students for years. Story 30, not a surgeon, but my mom had to have a mastectomy on her left breast. They were getting her ready and came in saying, okay, so we're going to remove the right one. And we're like a no, the left. The nurse goes, oh, hold on, and cue 15 minutes of endless right. Both left and several different nurses coming through. Finally, the surgeon comes and is like, left. The same surgeon told her the tubes they put in for drainage would be removed by the time she could go to work in a month. A resident came one day after the surgery. Toward the end of the day, told her he was there to take the tubes out. She said, no, the surgeon said it would be a month. He pressured her, took them out. These were stitched to hold them in place. The next day, she is in so much pain and her chest is swollen and hard. They call the surgeon, and he comes in without the resident that had been following him around. He's like, what happened? He is pissed. He drains her, and is like, we have to get the fluid out, and says to try it one way since they can't go back and insert the tubes. Christmas Day, he is in his office draining my mom's wound, but he's telling her what else to try to help the drainage. He had his resident apologize and laid into him, then said next time if there is a question, everything stops till you hear from the DR in charge. I had a minor one. I was having a root canal and had sudden pain apparently. I had 5 roots instead of standard 4, and it was visible on one x-ray as a thickened root, and another angle you could see just barely the 5 merged into 4. Nothing major, more pain numbing and extra time, but he kind of shook his head and said, weird, not the first time a medical professional has said that to me. Story 31, not a surgeon, but I was standing in on a total hip replacement with the most innocent, charming, polite orthodont, then hit the fan, and the screw wasn't holding and his tool broke. He so elegantly says, well, and stops and stares in silence for about 5 minutes. After that, the rest of the surgery was hand me the scalpel, or hand me the forceps, or the 5x5. Every time I saw him after, I just chuckled a bit. Med student here, I was going to be watching a procedure of a 60-something-year-old lady get her pacemaker leads changed on a Monday. Well, right before the attending began the procedure, and she was still a little awake before the anesthesia was completely administered, she let everyone know that she had smoked crack the day before. The procedure had to be postponed to Wednesday of that week to let the cocaine get out of her system. Then when the attending called the sister of the patient to let her know the results and any precautions they had to take, the sister asked the doctor if her sister could smoke again. Because the phone was on speaker, the entire room just face-bombed. Story 32, I am not a surgeon, but I have a story of this. May 27th, 2020, my 8-year-old grandson goes to his Yinti doctor surgeon for his surgery to have a cyst removed from his thyroid gland. Because of COVID, my daughter-in-law had to wait in the car in the parking lot. Simple surgery. Go in the morning, go home in the afternoon. An hour later, my son calls me. He's the dad, something went wrong, and my grandson is being rushed by ambulance to the local hospital with a children's wing. The damage was so severe that the surgeons there didn't know what to do. The original surgeon had cut my grandson's vocal cords, and he cut a hole in his larynx. They called to talk to experts at Seattle Children's Hospital. My grandson has been sedated and ventilated the entire time. The following day, the doctors recommend my grandson be flown to Seattle Children's Hospital. Mom gets to fly with my grandson. My son drives over by himself. They arrive Friday morning. The new surgeon does the 6-hour repair surgery from 5 to 11 p.m. Friday night, my grandson spent the next week under sedation and on the ventilator, and then the new surgeon opened my grandson up and told my son daughter-in-law that everything looked better than he had even hoped for. The surgeon had 3 goal priorities. 1, that my grandson would be able to breathe on his own and not need a tracheotomy. 2, that he would be able to eat and swallow on his own. 3, that he would still have his voice. After 2 weeks in Seattle, they came home, and my grandson is doing fantastic. He does have to go to Seattle to see his wonderful surgeon every few months to have scar tissue scraped from his vocal cords. But he is doing awesome, and that surgeon succeeded in meeting every one of his goals. 2 other items. My grandson has wanted to be a voice actor since he was 4 years old. The original surgeon that messed up called my son and told him that once he opened my grandson up, he saw that it was not a cyst on his thyroid gland, but a lymph node. Yet he continued to perform his surgery. Yes, my son and daughter-in-law have a malpractice suit against this doctor. Story 33. I had kidney operation when I was about a year or 2 old. The kind surgeon managed to stick me up with a 2 centimeters long piece of tube still inside of me. When they realized it was a bit too late, I was screened annually to see if the tube inside of me didn't cause any problems, which it did not for over a decade. Fast forward to me being 14 or 15. taking A and seeing something slowly slithering out of my penis. My first thought was that it was a parasite of some sort, and I freaked the out. Doctors of Reddit, please search your patients thoroughly before stitching them up. Thank you. Story 34. When I was in residency, my first solo procedure was a spinal surgery on a 16-year-old kid, a girl, and at the end, after 13 hours, I was closing her up, and I accidentally ripped her dural sac, shredded the base of the spine, where all the nerves come together, membrane as thin as tissue, and so it ripped open and the nerve just spilled out of her like angel hair pasta, spinal fluid flowing out of her and the terror was just so crazy, so real, and I knew I had to deal with it. So I just made a choice. Let the fear in, let it take over, let it do its thing, but only for 5 seconds. That's all I was going to give it. So I started to count 1, 2, 3, 4, 5. Then it was gone. I went back to work, sewed her up, and she was fine. Story 35. Dad is a vet, and I've helped him on many farm calls. One time we were pulling a calf out of dairy that refused to push for God knows what reason, when suddenly we heard a nasty pop and saw her hip drop. I am not sure exactly what went wrong, as this was a long time ago, and working with my dad convinced me not to go in a medical field for any reason. I don't mind blood and stuff, but the pressure would get to me quick, even with animals where the consequences aren't nearly as dire. But I do know they had to put that cow down. After we left, my dad had to look at me and give me a hard lesson on accepting failure. You can hate failure. It can make you feel not good enough. It can tear you up inside and crush you. And nobody can tell you it wasn't your fault or can make you feel better about it. But at the end of the day, life goes on, and all you can really do is accept it and keep moving forward. Story 36. I got a fun one. Many years ago, I was working in surgical research. We operated on pigs because they're the closest thing to humans. The experiment was investigating hemorrhagic shock and bandages treatments to deal with that. Like if you get shot in the femoral artery, what can stop you from bleeding out in seconds? We tested quick clot bandages and synthetic blood, etc. So we dissect out the femoral artery on this fully intubated, anesthetized pig. Usually the experimental procedure is cut the femoral artery, wait 30 seconds, and then apply the quick clot bandages. Except this time we did a slightly different procedure. Instead of a full cut, which bleeds into a big pool, we took out a hole punch, a small aperture. It was like putting your thumb on a garden hose. Total bloodbath in the surgical theater. One poor guy looked like Harry, covered in pig blood. Lesson learned. Cover the wound with a bucket before cutting. Story 37. I am not a surgeon, but I was a scrub nurse for decades. My worst moment ever was being told we had left an instrument inside a patient. Now that is our job. Count, account again, and repeat. I had always prided myself on knowing exactly where all my instruments were at all times. Now you have to realize we can have hundreds of items out, but at the end of a case we go through the trays again and double, triple check. So where the had to come from, even our CSSD staff Central Sterilizing Services Department hadn't alerted us that anything was missing, so turns out patient hadn't been well post-op and had a barium X-ray. Barium was put into the bowel through a tube in the rectum, and the tube was then left in place, clamped, and a clamp placed on the abdomen. Cover said patient with a sheet whilst X-ray was done, and hello, one clamp showing on X-ray. I saw the film, and it was scary, but the surgeon and I said straight away, it wasn't one of our surgical instruments, and if they had just showed us straight away, we could have avoided the panic. Poor patient was even told, brought to theater for removal of the clamp. They were delighted to be told what had actually happened, a day we never ever forgot. Story 38. I was working in an animal research lab, and my job was to make incisions and insert catheters into the hearts of rabbits through the carotid artery. I had a defective catheter with a sharp tip, and somehow I managed to have the catheter exit the carotid somewhere in the chest cavity of the rabbit. I had to step aside for a more experienced surgeon to take over from there, because my confidence was shaken. Luckily, she was able to save the rabbit. Edit for context, the research I was working on was for finding a cure to a disease called infective endocarditis. It's basically where bacteria get into your bloodstream and attach to damaged areas of your heart. It's extremely serious. Almost half of all people who contract it die, and it kills thousands of Americans each year. Animal research in the U.S. is taken extremely seriously, and the process to get approval for even the simplest experiments using animals is extremely rigorous. Our rabbits were fully anesthetized during the procedure, given pain medication for post-op, and treated with the highest standards of ethical care pre- and post-op. Please, before you judge, remember that animal research has saved hundreds of millions of human lives. I have nothing but the utmost respect for the animals that help us to better humanity. Story 39. From my days as a vet tech 20-odd years ago, small dog in for surgery, because he, if I remember correctly, hadn't peed for days, but was otherwise healthy, some sort of blockage that couldn't be handled in the exam room. So we get him sedated and prepped for surgery. Dog is splayed, open on the table, and his poor bladder was as full as the best water balloon you've ever seen, except this is full days old urine. And of course, like a good water balloon, the slightest pressure caused it to burst all over teenage me and the good doctor. So I'm in shock, pee dripping off my face and covering my scrubs. No mask, face shield, etc. This was a vet office in Alabama. We didn't need no stinking PP, except I desperately need PP at that moment. We cleaned up the dog, got the ruptured bladder repaired, and stitched him back up. I'm pretty sure that was the moment where I decided my childhood dream of being a vet wasn't quite as glamorous as I thought. Story 40, not necessarily a mistake, but a weird oops. I was the patient. The day I turned 14, I had an ovarian cyst rupture and bleed into my abdomen. They took me to a children's hospital, and they decided on surgery to drain the blood and an appendectomy. Because I already had horrible pain on that side, and it looked a tiny bit deteriorated. I had an uncle die from a ruptured appendix, and they didn't want any risks for me. When they removed it, they used a surgical staple to close off where the appendix was attached to the colon. The problem was I actually had PCOS and was diagnosed a day later, so multiple ovarian cysts showing up and pushing on stuff in my abdomen was going to be a regular problem. 7 years later, horrible pain, bunch of cysts again. I get taken out of college and rushed home for surgery with my OBGYN thinking it's endometriosis or something. Nope, it's the staple from my appendectomy in the middle of my gut floating toward my stomach. She later figured out that this was actually a reoccurring issue, especially for women who had PCOS or who were younger. In a few cases, she found they ended up migrating to the skin and trying to come out of the body. It wasn't malpractice or a true mistake, just what they used at the time versus what they would have done now. My OBGYN had some choice words regarding the previous surgeon's decision. Because I was her third patient in 5 years this happened to,